the meeting of the Health and Human Services Committee to order. First item on our agenda is public comment. Was there anybody signed up for public comment?
No, there isn't.
Okay, thank you. Then we'll move on to item number 3, approval of the December 1st, 2021 Health and Human Services Committee meeting and the January 5th, 2022 Joint Public Safety and Health and Human Services Committee meeting minutes. Do we have a motion for those minutes?
This is Will Harris. I'll make a first motion to approve.
Okay, do we have a second?
Supervisor Seibert will second.
Okay, thank you, Supervisor Seibert. All those in favor for approving the December 1st, 2021 minutes and the joint meeting of the Public Safety and Health and Human Services Committee January 5th meeting, say aye.
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 Those opposed say no. Okay, motion carries. Item number 4, policy issues, discussions, and potential committee determination. We have none today. Item number 5, operational functions required by statute, ordinance, or resolution. We also have none today. That brings us to item number 6, educational presentations and committee discussion. Item 6A, ADRC update presentation. And I believe Mike Ray from the ADRC is there in person.
This is Administrator Leonard. Mike is here, and he'll come up to the podium in just a second.
All right, can you all hear me now? Just want to make sure. Okay, excellent. Well, thanks for having me. I appreciate the opportunity to come and talk to this committee and provide an update. Tim had asked me if, I think it was actually within the last couple of weeks, if I could provide you all an update in regards to ADRC and ADRC services. I won't go into a ton of details, as I know most of you are familiar with the services that we provide, but I do want to give kind of a very basic explanation of our organization and then go over some data numbers with you so that you can see some of the impacts of the customers that we're serving within Marathon County. And then also leave some time at the end for some questions if you have some questions or of me that you would like for me to answer. So the ADRC of Central Wisconsin is a 4-county regional operation that serves Marathon, Wood, Lincoln, and Langley counties. We are formed by an intergovernmental agreement by those 4 counties to be able to provide the services required by the state for ADRC. We are an integrated agency, which means that not only do we provide ADRC services, we also provide the Older American Act programs, such as our Meals on Wheels and nutrition programs, caregiver support coordination, as well as some healthy living or prevention-based programming as well. So ADRCs are really tasked with being that first stop for anything related to aging or disability. So that can be anything that could be as simple as a person contacting us to identify a telephone number for a resource, all the way to sitting down with a customer pre-pandemic that was in their home. During the pandemic, that has been a lot of virtual and over the phone. We are currently having in-person appointments within our offices, but that could be sitting down with them, going over all of their needs, care needs, support needs, questions, identifying what plan of support may be best to help support them, hopefully within their community, in their own home, and to build that support services around them. That would also include talking to them about their financial resources, how they're able to pay or not able to pay for those support services, and what those options may look like. We are also the entity that is the starting point for the Wisconsin long-term care programs, such as Family Care and IRIS, and we do that initial eligibility determination for those programs to determine if they are functionally eligible for them. Those programs are also, they are Medicaid-based programs, so a person needs to be functionally and financially eligible to be eligible for Family Care or IRIS. We have a lot of different other services that we provide. In addition, we have within this last year, year and a half, we have what new to our organization is a dementia care specialist, and we actually now have 2 of them to serve our 4-county region. This was actually added in the last biennial budget by the governor to make the dementia care specialist position statewide. And those positions are really the experts in dementia care and understanding that the disease, helping people with newly diagnosis to understand what the progression will be, some mitigation efforts to be able to help them minimize those symptoms, and then working with their families as well and helping them understand what that progression is going to look like, support services, educational opportunities for them to really provide that support around them. In addition to that, we have caregiver support coordinators that kind of go hand in hand. Many people who are a caregiver aren't necessarily people that have signed up to become a caregiver. They didn't necessarily go to school to become a caregiver. They had a family member that had an event or something that required them to take care of them, and now all of a sudden, you're a caregiver. And what does that look like? And how do you make sure that you are, one, taking care of yourself, because that's extremely important, to make sure that if you can care for somebody else, you have to care for yourself. And then what are the tools needed for you to be successful at caregiving? How do we support you in that role? We also have prevention-based programs that help individuals try to prevent things such as falls. Right now, the number one admission for hospitals is falls. And so if we can help you prevent those falls through some strengthening, through some education, through some understanding of different concepts within your home and around the community, we're going to help do that. We have some 7-week educational classes that help with those education of doing those different strategies. Obviously, we have our Meals on Wheels and nutrition-based programs. Just some data components in regards to that. We served over almost 65,000 meals within Marathon County during 2021, which is significant. We have a caterer that brings the meals to a nutrition site on by our office. They package those meals, and we have drivers, both volunteer and paid drivers, that deliver to every nook and cranny in Marathon County. And if you've been into rural Marathon County, you know that there's a lot of nooks and crannies that are out there. So we try as hard as we can to deliver in all elements. Obviously, when there's a foot of snow, that can prevent us from getting to some of those places. So a program that we actually partnered this year with Peyton, last 2 years with Peyton's Promise, and with the Girl Scout troop and local Girl Scout troop, we were able to provide what we call senior snow day meals. For those times where we can't deliver meals, people at least have shelf-stable meals in their homes that they can use during those times. So a lot of services that we have. So that doesn't even probably get into all the depths of them because they are really complex. I think the biggest aspect that we always tell people, if you have questions regarding anything aging or disability, you contact us. And to be truthful, it will impact all of us at some point in time. We're all aging. A lot of us have aging parents or grandparents, and just having that understanding, because it's very complex in all the different systems and all the support that may be available, and understanding all those options really helps to have somebody walking alongside you that knows what those options are. So I'm going to end a little bit with some data, because I love data. A lot of people love data. So again, as I mentioned, we served just over about 65,000 meals. In comparison, in 2021, in comparison to 2020, that's actually down. In 2020, we served about 74,000 meals. Some deductions as to why. It could be that, with the pandemic, some of them may have gone from getting meals from 5 days a week to maybe 2 days a week. Maybe a family member was able to provide some meals to supplement that. We served 670 customers in 2021 in Meals on Wheels. Our resource specialists, which are the ones that usually take a lot of the phone calls coming in working with customers, served close to 4,000 people in 2021. With over 10,000 contacts with those customers. We were able to help close to 270 individuals enroll, in Marathon County individuals enroll into those long-term care programs for that additional support. So we have, obviously you can see we serve a lot of people. You may have also heard the population is continuing to age as the individuals turning 60 and older is growing exponentially. We are definitely seeing an increase in our customer volume, but also an increase in complexity. So it has definitely been challenging to continue to serve all the population. We're doing a great job through that. So I would entertain questions at this time if you have any questions for me.
Does anybody have any questions for Mike? Supervisor Krause, if you have questions, I can't see you, so just go for it. Otherwise, Mike, I do have a couple questions, and they might be a little specific, but one of them was, do you assist with taxes at all?
Do we assess it?
Like income tax?
We don't specifically assist with taxes. You know, that is a question that we get a lot, and unfortunately this year, generally we've referred individuals to AARP for free tax support. And I know this year that is a service that's not being provided by AARP, but there are some other resources that are available that we can connect people to for some tax support. It may not necessarily be that in-person sit side by side tax support, but there are some resources that are available free of charge.
Okay, thank you. And then my other question was, how does somebody sign up or qualify for Meals on Wheels? Is it just you say that you need it, or do you have to go through an eligibility process for that program?
Yep, that's a great question, Michelle. So our supervisor, Van Cray, sorry about that. Yes, there is some eligibility requirements for our Meals on Wheels program. You do need to be 65 and older, and need to be primarily homebound for the Meals on Wheels specifically. So that doesn't mean you're in your home all the time, but primarily you're not out driving around the community. If you do have the capability to drive around the community, we do have congregate meal site as well at the 500 Grand apartment building. I know that we've had limited service during the pandemic due to obvious reasons of getting people together, but that is one of our meal sites. And we're also opening another brand new Hmong meal site, Hmong-specific meal site at the Hmong American Center.
Great, that is exciting news. Those are all the questions I have. Yeah, was there anybody else that had questions for Mike?
I did. Madam Chair, I do.
Go ahead.
Thank you, Madam Chair. Kurt Gibbs here. Mike, could you, provide us the easiest way to get a hold of you, or let's say we have somebody that we want to refer to the ADRC, maybe some contact information would be helpful.
Absolutely, and you know what, I will tell you that we do have a toll-free telephone number that individuals can call, and I have it. I'm not going to give it to you wrong, so I'm going to step back and grab my brochure, and so that you can have that contact information. And I can also pass that on along to the committee to be able to be sent out to you, if that would be helpful. But yeah, there's many different. Oh, thanks, Lance. Look at that. So our toll-free telephone number is 1-888-486-9545. And you can call that toll-free. That will go, from anywhere within our region. That will get you connected within our organization. You can also go onto our website, adrc-cw.org. I couldn't remember if it was at ADRC, so it's adrc-cw.org. And we also have a online request that you can send an email into us as well. And we're getting a lot of those requests coming in as well. Yes?
Hi, this is Supervisor Donna Krause speaking. I would like to make I'll give you some compliments about the Aging and Disability Resource Center and some experiences I've had with it. I was living in an apartment on the second floor, and we had a really, really hot summer. It must have been 90, 100, or 100 more degrees. And there were elderly who were dying because of the heat, exhaustion, and so on. And I didn't die, but I became dehydrated and my blood pressure shot up and I was dizzy. And I had called the Aging Disability Resource Center, and the young lady who answered the phone helped me out. She said I could come over and pick up an air conditioner. So I got an absolutely free, brand new air conditioner. She must have called somewhere, Target or Walmart or wherever, and they must have donated a nice big window air conditioner. So I got an air conditioner. It helped in one room.
Yes, yes.
But so that was really one really good experience. So they do help out in other ways, I'm thinking. I don't know how often that's done, but it was done for me, and I really appreciate it. And then the other experience I had is that there is a chronic pain support group with Learning, a booklet from doctors out of Sanford and Berkeley, California. That was just wonderful. And I forget if it was like a 9-week or 12-week, but it was a group, we had about 4 or 5 people. And it was a good learning experience. It was very helpful.
Yeah, I appreciate that. And those educational prevention programs are all evidence-based programs. And so they're all researched, determined to be effective. And yes, one of those is living with chronic conditions or pain management aspects as well. So yeah, thank you for those positive examples.
Did anybody else have questions for Mike? Okay, if not, thank you, Mike, for your presentation. If you do have like a electronic version of that brochure that you want to send to the committee, I'm sure we would be able to use it to pass it on to people we know.
Absolutely, I'll send that out. Thank you.
Thank you. Okay, the next item, item number 6B, the CATS presentation, and I believe we have Kathy Buckley there in person as well to give that presentation.
Hello, my name is Kathy Buckley, and I am the director of Keep Area Teens Safe. We opened on March 15th, so we have not been open quite a year yet. So what is CATS? CATS is a nonprofit donation and grant-based facility serving runaway, homeless youth as a bridge to services for kids in unstable conditions. We provide safe and secure housing, meals, case management, connection to mentorship, academic support, and other community services for youth in central Wisconsin. We focus on creating a welcoming and trauma-informed environment for youth populations we serve. We serve youth 12 to the age of 17. There is a common misconception that youth must be living on the streets to be homeless. The definition of homeless has many different forms. We refer to homeless youth as a silent population. Why is that? It's because they're very hard to track. Youth tend to couch surf by staying with family members or friends. They experience youth experiencing family conflict and possibly an unsafe home environment, sleeping in parks, laundromats, and churches, traffic youth staying with their traffickers, youth have been placed in multiple foster care homes over a short period of time, and runaway youth. Youth homelessness means a high risk. 90% of the youth we serve have been trafficked in one shape or form. We also see them at high risk for abuse, both sexual, emotional, physical, substance, and neglect. Difficulty forming trusting and healthy relationships. They tend to run away from home. They're at high risk for human trafficking, use of illicit drugs and alcohol, mental illness, lack of education, hunger and malnutrition, and possibly suicide. There are many reasons why youth can be homeless. Neglect and abuse, family conflict, loss of family income, evictions, poverty, Mental illness, that does not only mean the youth, but other family members. Substance abuse and addiction. Many parents sharing their addiction with their youth. Victims of human trafficking and domestic violence. So what does a healthy home look like? And this is what we really work towards at our program. As you can see, communication, compassion, commitment, being vulnerable, sharing your story, encouraging to want to make that change, providing those opportunities to experience life as a normal teenager, being truthful and honest, having fun, again, being able to not be a parent, being able to attend basketball games, extracurricular activities, understanding and empathy from the staff, and most of all, stability and security. Nationwide, 1 in 30 youth between the ages of 13 and 7 has experienced some form of homelessness. That means they're unaccompanied by a parent or guardian over the course of 1 year. 29% of homeless youth report having substance misuse problems. 69% report mental health problems. Again, mental health problems that go undiagnosed and untreated. 33% of homeless youth have once been within the foster care system. 50% of homeless youth have been in the juvenile justice system, in jail or in detention. 62% of the LGBTQ youth report being physically harmed and experiencing homelessness. It is really hard to pull data for the state of Wisconsin and local data. And again, it's because we talk about that silent population. This age group tends to, what we do is called fly under the radar. They are able to find places to stay. They are able to find temporary housing and food, but they are still homeless. Okay. During the most recent statistics that we were able to find are 2017 to 2018, 18,853 Wisconsin public school students experienced homelessness. Of that total, 316 were unsheltered. 2,257 were in shelters. 1,176 stayed in hotels and motels. 15,000 were doubled up in more than one location. And in 2018, 11.6 of high school students in Marathon County reported sleeping somewhere other than their home for extended periods of time. So again, that definition of what is homelessness can have many different forms. So what do we do at CATS? We provide a safe place for youth to stay up for 20 days with parent or guardian permission, and I'll talk a little bit more about that. We assist case managers in finding long-term placement for residents. We work directly with case managers on ensuring that the youth does stay in touch with them as well. We teach life skills, cooking, laundry, cleaning, financial responsibility. We have a local bank has come into our facility. Most of them don't know what an automatic deposit is, where the routing number is on a checking account. So we've been able to bring those types of skills. Group talks. We engage in conversation in very diverse topics. We have volunteers who come in and provide the information that they need, from safe sex, nutrition, what medications are, what are the side effects, what's the importance of medication. So there are many topics we address. Educational program. We have brought tutors into the facility. Reported from DC Everest and Wausau West, students that have been in our program have excelled excessively at school, and attendance has gone up by 90%. Recreational activities. We take them ice skating. We take them on walks and hikes, teaching them to enjoy things, ways to de-escalate, ways to handle them being upset, handle the emotions through redirection. We help them find jobs if they need to, helping them develop a resume, interviewing skills, the responsibility of communicating with an employer when you are not able to come into work. Connecting residents with local mental health resources. We currently team up with Peaceful Solutions. They have been amazing. We are able to get our youth into treatment, usually within the first week of being within our facility, and have consistent appointments set up. Provide community support through our Teen Supporting Teens program. At CATS, it's not just about filling 8 beds. It's about how do we educate where those resources are available. So we started a Teen Supporting Teens program. That number has grown. It's twice a month on Tuesday nights. Wesley Church gave us a free spot to hold that, and our numbers continually increase on Tuesday nights. We do provide a free meal brought in by volunteers. We provide a group session and then some social time. It is through that program that we have helped teens avoid being at CATS, returning to the home, providing resources. So again, it's not just about filling beds, it's about providing those resources in the community for teens struggling. At CATS, it's not just about laying down your head and hanging out. We do provide a school day program schedule and a non-school day program. Why is that? We enforce structure that is needed to ensure attendance and performance in school, ample opportunities for residents to learn life skills, time to bond with other residents. That's really important. Learning to be able to open up and share. We provide recreational and group activities, and that structure also ensures adequate sleep schedule to ensure cognitive development. What is our vision, our mission, and our model? It all started with a vision to serve North Central Wisconsin by providing unaccompanied runaways and homeless teenagers a safe temporary home. Our mission is to serve the community, to bridge that gap. It's really difficult as they age out of the youth system. By the time they get to the adult system, we see that 16 and a half to 18 where support is needed. A model, again, is to provide a safe transitional home for 18s at any given time. We do admit 24/7. We do have staff available as well 24/7 and a director and an assistant director. I do have some pictures here of our program. Again, our TV area, that is the area that, the only area we do watch TV. We do empower our staff. Those 3 pictures were developed by our staff to liven up our entryway in our intake room through generous donations of individuals and the community and 12 great board members. You can see our facility is amazing, very welcoming, and it's kept up. Again, it's maintained very well. We did do our ribbon cutting on June 15th, which we did have one of the biggest turnouts by the chamber. A lot of individuals had not heard of our program, so that was really a great day for us to share our story. The youth at CATS are required to give back. One of the programs that they do work with is Keep at Middle Grounds Coffee. It is a young group of individuals located on Thomas Street, and our youth have been welcomed there and take part in a lot of their volunteer programs. Our youth also have helped out at the Boys and Girls Club, attended the Boys and Girls Club, and have helped clean up some yards in our neighborhood. So what have our experiences been like? We were coming up on a year, and we sat down and did reflect on this, and where do we want to go from here? We've served youth who are waiting for foster care placement, youth who are victims of human trafficking, were influenced by substance abuse, trafficking by their cultural norms, placement of youth by parent, guardian due to conflict and unstable situations. We've seen youth who would have run away and not sure where they would have been if we had not taken them in at CATS. Our biggest challenge sometimes can be family support. What can we do to work with the family to reunify? Is that even possible? Inability for youth, we serve to trust adults. That takes time. It's not a day, it's not a week. It sometimes can be the whole 20 days till they really begin to open up to us. Behavioral challenges. The only way we survive when we don't know how to control our emotions is through anger. So how do we change that? And really what a misconception of what shelter care is. We are not a locked facility. We are not a cinder block facility. We're a home. We're a home. So what has our results been? Building trusting relationships and long-term relationships. Open and honest discussion between staffs and residents. Learning how to cope with behaviors in healthy ways. Learning how to positively manage conflict resolution without breaking a lamp, without pounding a wall, without hitting another resident. Youth looking forward to a better life and planning for the future. Youth staying with us, applying for college in the fall, looking for ways to get caught up in school. Staff continues to check in on youth after leaving CATS. Obviously, we need permission to do so, but most of us call us and share their experience and where they are and their successes, which drives us every day. So we opened March 15th of 2021. In that time, we've taken 27 admissions. 25 of these were youth residing in Marathon County. 2 of these youth were from outside Marathon County. Average days of stay is 16. Of those that discharged, 3 went to facilities, such as Tomorrow's Children, Rawhide. Those are example of facilities that they would go to. Milwaukee Academy for girls. 13 of them went home. 1 went into foster care. 4 went into apartments on their own. They were 17 years old and were able to find housing and a roommate and went into an apartment and got a job. And family outside the home. Okay, so we had 1 move in with a family member. So who refers to CATS? And how does a child end up at CATS? A child can end up at CATS in many ways, shapes, or form. They can knock on our door and say, I have nowhere to go. Marathon County Social Services recently has referred youth to us. The Wausau Police Department can be a referral source. Wausau West High School counselors. We have had huge success working with them. They're very responsive. They're very involved in the education and the youth. DC Everest High School and Middle School. North Central Healthcare. We've received a lot of referrals from them. We actually do on-site assessments prior to the youth coming to us. Peaceful Solutions Counseling, the Mosinee School District, Wausau East, John Muir, family members, and other counties' social services. I'm gonna just ask if there's a lot of information here, so do you have any questions at this time before I go into some of our other costs and things like that?
I have,
Kathy, go ahead, Donna.
I have some questions, Supervisor Krause. I know that I was a manager in the mall, and I hired young kids. I think it was like 16 and above. And there were complaints then that the teenagers would work for a week or 2 until they got their check, and then they would quit. Mm-hmm. But I do know at that time the mall was a big hub, a big center for employment of youngsters, young adults. And now that that's gone, I'm wondering, and especially during COVID, where do you find places to employ them now?
Any youth willing to work, the opportunities are out there. We do try to find employment in our area. We are located just up the hill from Triggs, now Festival Foods. So there is quite a few areas of employment there. So they take the bus or they'll walk. Sometimes we drive them, and if it's late at night, we'll pick them up. But there's so many employers that have been great, especially I really don't want to identify just because our youth are working there at this time, but there are a lot of employers that there's an unlimited amount of jobs is all I can say. Most of our kids, once we start looking, have a job within 2 to 3 days. So,
Thank you.
you're welcome.
Kathy, this is Michelle Van Cray. I did have a question about the component you touched on that you do have to have parental permission for the youth to stay there. So could you just explain a little bit like how that works, and do you run into issues where parents say no, and then what happens in that situation?
Sure. So we are a volunteer, defined as a voluntary facility. So when a youth does come to our facility, if they are not accompanied by a parent, we have a procedure we follow, and that procedure is we try to reach a parent. If we're unable to reach a parent in about 30 to 45 minutes, our agreement with Wausau Police Department is to call them, and they will help us locate a parent. We'll review the situation of why the youth came to us. I have yet to have a parent refuse to allow a child with us. We do talk to the parent, what's going on at home? Is there anything that, do you need a break? Is there something that we can help you with? Are there some resources? So at this point, I have not had a parent not say the child couldn't stay with us. But if they would, then we would, again, work with law enforcement, and we would try to figure out what's the best situation. Not making that decision if certain situations do come about where there may be some form of abuse or neglect, then at that point, the Wausau Police Department would contact social services or CPS. So, but at this point, most of the time, if a parent says no up front, we'll say, do you understand what we do? This is a voluntary program. We explain the resources that we can both help the youth and them, and we've never had a parent say no.
Okay, that's great. Thank you. Did anyone else have questions for Kathleen before she continues?
So in order to stay at CATS, we do have criteria that has to be met. So if a child does not meet our criteria, for example, they're involved in the juvenile justice system, that doesn't mean we say, sorry, we can't help you. We will then look for resources to direct them to. So we're not just leaving a child with nowhere to go or a parent with no resolution to their issue, okay? If a parent is struggling as well and needs to have a break from the child at home. So we do work with other organizations to find placement. So keep area teens safe. Obviously, I'm sure you all understand it is a costly venture. 500 right now, our budget is aiming at $550,000 for the year. Just so you understand, we'd never charge a child or a parent for services at our program. That $550,000, you can see the list of items there that it does cover, and we are able to generate revenue. We are solely supported through private donations and grants, and we do a lot of that fundraising on our own. So our current funding resources are grants, private donors, corporate businesses, local owned establishments, the Community Foundation of North Central Wisconsin, city block grants, and numerous community members. Again, the Wausau community has been extremely generous to us and very supportive, so I very much appreciate that. I do have lots of letters of support here. Again, we can put this PowerPoint maybe out so people are able to go through and read that. So what is, what?
It's on the packet already. So
Okay, perfect. So what does the future of CATS look like? Like I said, we've been open not quite a year. Our average census right now, since November, has been 5. We get kids coming in for a day or two, some staying for 20 days. We are seeing the Wausau student population has been, right now, is about 90% of our intake. Again, we do serve Everest and Mosinee as well, but most of our students or our youth are coming from the Wausau. from the Wausau school districts. So in the future, again, foundation grants, state and local grants, at some point, once we are able to establish some numbers and financial reports and report out on the success of our program, we will be looking to the city of Wausau and possibly Marathon County. Again, this is just a slide on opportunities to support our vision. We did buy an existing building, and as any building, there is upkeep. So we always, when I do my power presentation to organizations, I do present some of our costs that are out there. Again, we do apply to grants through the foundation and some other grants that are available out through the state of Wisconsin to help support us. We have a lot of major donors again. I can't even begin to thank as many, everybody, how grateful we are and what this means to our program. Even our small contributors, I say $5 is crucial. It doesn't matter the amount, any amount really ensures the future of our program. And then here's our Teen Supporting Teens group. So I want to read, we had a couple young youth do a presentation. We're making a video, obviously they're not on the video, but there's a voiceover. We will be putting that out too on our website so you can view it, just what CATS has meant to these individuals coming out of trafficking, not knowing anybody, and what that has meant to them now enrolling in college in the fall with CATS getting them back on track, getting them back into school, and the need to make a change. So any other questions? Again, this is a lot of information.
Does anybody have questions for Kathy before she ends?
And my contact information is out on the PowerPoint. We also have a website, catswi.org. It's a brand new website. You can see all our donors. You can see our needs. There's statements from youth that have been with us and what CATS meant to them. Talks about our program, our board. Currently, our board is at 13. We have 4 new board members. So we're continuing to grow that way. Okay.
Thank you for coming to present to us today. Your organization is incredible and it's doing great work in Marathon County. So I really appreciate the update for us to learn more about it. Does anyone have final questions for her? Okay, thank you, Kathy. Okay, moving on to item number 6C, update on proposed revisions to the intergovernmental agreement establishing a multi-county Department of Community Programs, North Central Community Service Program. Administrator Leonard, I believe that item is you.
Yes, thank you, Vice Chair. I'll be brief. Really, this is a follow-up from your November 3rd meeting last year where I appeared and gave a short update on the work of the North Central Healthcare Executive Committee. And just as a little bit of background and kind of ground setting here, we have under the current contract, the Tri-County Agreement, as we often refer to it, the Executive Committee of the North Central Healthcare Board, or the frequently referred to as the North Central Community Services Programs Board, the Executive Committee of that board is charged with bringing forward potential revisions to the Tri-County Agreement to each of the 3 member counties. Again, that's Langlade, Lincoln, and Marathon counties for consideration. Now in 2021, the North Central Community Services Programs Board worked with Andy Phillips, at the time an attorney with Van Briesen and Roper, now currently with his own, with a different firm. But in working with Andy, he really laid out a framework from his analysis. Some opportunities existed for us to make some improvements to that contract. And when I appeared before you in November, I essentially gave a high-level overview of that framework that Attorney Phillips laid out. And essentially, it called for us to utilize 2 statutes under Wisconsin law as opposed to just one in crafting the tri-county agreement. And specifically what I'm referring to is our agreement had largely been under the architecture of Chapter 51, specifically Section 51.42 of the Wisconsin statutes that allows for a multi-county, again, Langley, Lincoln, and Marathon in this case, multi-county Department of Community Programs. And the statute lays out some general architecture of what that looks like, and it provides information about how many individuals are on the board. It provides information about how those board members are appointed. It provides information about what the relationship looks like between the leader of that multi-county department and the board. And also it provides, in a stark contrast within that same statute, is what does it look like if you were a single county Department of Community Programs? And it does those same things. How are the board members appointed to that community programs board? What's the relationship of the leader of that single county department? And in speaking with Attorney Phillips, he suggested that rather than simply use the architecture under Chapter 5142, we also look at utilizing Chapter 59.52, subsection 7, giving you the full statutory citation. But essentially, in speaking with Attorney Phillips, he advised the North Central Board and specifically the Executive Committee that what that statute, which is relatively new, less than 10 years old, what it allows is for the joint cooperation of counties to come together and cooperate and to really have more flexibility into how they would set up such a multi-county department. So we wouldn't be we wouldn't have to strictly follow the Chapter 51.42 provisions relative to really a number of things. So Attorney Phillips made a couple of areas known to us that he asked us to look into, he suggested we look into, and we're working on that for quite a number of months, the Executive Committee of the North Central Healthcare Board. And one of those I've already referred to, and what is the relationship, and that is what is the relationship of the leader of that multi-county department with each of the 3 counties, providing some additional clarity there, but also moving more toward, and I referenced this at the last meeting in November, moving more toward the architecture of a single county department of community programs where the oversight and the relationship is much more closely tailored to the member counties' administrative officers as opposed to the appointed multi-county community services programs board. So things like the opportunity for the consideration for hiring, developing the hiring process, hiring itself, the disciplinary process or removal, all those things that fall under that umbrella of relationship of the leader of that multi-county community programs department. That, again, Andy suggested we utilize Chapter 59.52 to help us move that to the more administrative side, operational side, than the Community Services Programs Board side. He also suggested, and we did look into, how do we have members of the multi-county Community Services Program Board, how are they appointed, and that's provided for in a couple of statutes under Wisconsin law, but also clarifying what's that process look like for individuals coming off of that board? When, if at all, can an individual be removed from their position, and what does that look like? Because under Wisconsin statutes, there's certainly a stark difference under Chapter 51.42 for, again, a single county versus a multi-county. So that was a second area we looked at. And then the last one that I'll talk about is really, I guess I'll call it a broad umbrella of ensuring, how can we ensure through the structure of our agreement the strong tie to each of the 3 county governments, the owners essentially in our system. And again, that's talking about how do we move to that more administrative approach. We look at the 3 county administrators, from Langlade, Lincoln, Marathon County, as well as one additional member of the Marathon County Board as the current format that we've drafted the tri-county agreement. How do we make sure that those individuals are really tied in to the decisions and operations of North Central Healthcare? So that's the kind of status of where we've been. We've been working on that. I don't have an agreement for you today. It's currently being reviewed by legal counsel internally and externally, and this is something that we're going to have to take under Wisconsin law. That's something that has to be reviewed by the Department of Health Services. So we're trying to get some initial guidance from them. We don't anticipate any issues, but essentially that's the work that's been happening. I think we've made some good progress. And again, when I talk about clarity, this is one of the things that Attorney Phillips talked about. You know, under the current agreement, relative to the oversight and management of the director, the head of the organization of North Central, that multi-county department, it's really unclear how many boards and committees may be involved in really important decisions. I'll just give you an example. There are 5 committees that, in speaking with Attorney Phillips, that may have to be consulted for really important decisions relative to that CEO. You could have the executive committee of the North Central Community Programs Board. You could have also the North Central Community Service Programs Board itself. And then you have each of the 3 member counties. 5. And Andy asked a very succinct question during one of our meetings. What happens if one disagrees? And we didn't have a great answer for that. So this new agreement is really trying to get at a couple of those key pieces. Again, that relationship, clarity of the relationship between the leader of that multi-county department and each of the three counties. The role of board members and how they're appointed and potentially removed from their positions. And then how do we really ensure that tie to each of the 3 owners of the organization? So moving forward, our goal was, the executive committee's goal, of which Chairman Gibbs is a member, as am I, along with Kate Wiley, the administrative coordinator from Lincoln County, and Robin Stowe, Corporation Counsel. He is the designee of the county administrator in Langlade County. Our goal was to try to bring to the county boards, each of the 3 county boards, in February, a final proposed revision. And we wanted to at least make you aware of that. And our request is going to be, if that continues to be our goal, if we can get that legal review done and move forward, that we may ask all of the members to have a special meeting yet this month to get it before this committee, before going to the full Marathon County Board in February. We're also trying to coordinate with Attorney Phillips to have him be available for the presentations at our educational meeting, and each of the other 2 counties. They simply have one board meeting a month, but trying to coordinate Attorney Phillips' schedule as well. So that's the overview, and like I said, Chairman Gibbs is a member of the executive committee. If there's anything that I missed, Kurt, feel free to add, but otherwise we can take questions.
I think, Lance, you did a fine job. I think, like you've always said, I mean, the clarity is the challenge, and providing that clarity, transparency, and accountability.
Thank you, Administrator Leonard. Did you have an idea of what date for that special meeting, or is it still contingent on the legal review?
It is the latter, still contingent on that legal review, and we'll reach out. I know Chair Butkey's unavailable certainly today, and you're chairing the meeting, but we'll reach out as soon as we have that done to try to coordinate that special meeting. We also have to have a conversation with Lincoln County. I know they had a late change to their board meeting calendar, so we have to make sure that those calendars kind of align as well.
Thank you. Does anyone else have questions for the administrator?
Supervisor Krause does have a question.
Yes, thank you. I am a little bit confused about this, and because you're talking about all these different statutes, and you're talking about a single county department. So we're not going to a single county department, we're keeping it the 3 counties under an administrator rather than an appointed group?
The first part of the answer to your question is yes, we're maintaining the multi-county department.
Okay.
I don't know that I can answer the second part. The process for selecting the head of that multi-county department is going to be specified in that agreement, and it would be housed within what we're calling the executive committee, which would be made up of those 3 individuals that I talked about, the chief administrators from each of the 3 counties, and 1 additional member from Marathon County that is appointed by the Marathon County Board of Supervisors. I should say that's confirmed by the Marathon County Board of Supervisors, but it's clarifying where is that direct relationship with essentially the department head of that multi-county department. And I should have also alluded to this point. The North Central Healthcare Community Programs Board, that multi-county board made up of 14 members, there's immense value there. And our agreement really tries to balance what needs to live under that, what we're calling again, the executive committee, that really administrative piece, and how do we make sure we continue to have great value from the North Central Community Programs Board, because they do provide a very important resource which is set forth in the statutes, and that is they represent the community, whether it's as individuals in need of mental health, substance abuse, and other treatment, that they're supposed to represent those interests, but also significant stakeholders. So within our current North Central, on the current North Central Healthcare Board, you have individuals with significant finance background, which is very helpful. We have an individual from, at least one individual from one of the local healthcare systems. We have law enforcement representatives. We have county board members. So there's a broad array of skill and talent on that board, and we want to make sure we continue to leverage that while also making sure that there's kind of a clear tie to each of the 3 counties through their administrative officers.
Okay, so basically it's an organizational development change in how everything is structured. It's a new structure, somewhat new.
Yeah, somewhat new. I'd say it's not fundamentally different in any way. It's very similar, in fact, to the contract for those of you that are have a bit of tenure on the board. That was developed in 2015 and approved by the board in 2016. Attorney Phillips just simply gave us some additional tools to make some changes to that agreement that he highlighted in our conversations with him. So, but I certainly wouldn't say it's a significant change.
Thank you.
It is a lot shorter, which I think is a good thing.
Does anyone else have questions for the administrator? No? Okay. Thank you, Lance.
Thank you.
Okay, item number 7, next meeting time, location, announcements, and agenda items. 7A, committee members are asked to bring ideas for future discussion. 7B, next scheduled meeting is March 2nd, 2022 at 4 p.m. And item number 8, adjournment. Do I have a motion to adjourn?
Supervisor Conring, I make a motion to adjourn.
Thank you. Is there a second?
I will second it.
Thank you, Supervisor Krause. All those in favor say aye.
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 Opposed? Great. Motion carries. We are adjourned. Thank you.